you're going into these arteries through the patient's wrist. In the literature, it seems that the other option was through the groin. How is the wrist better than going through the groin?
It's not necessarily better.
Okay.
They're both comparable and they're both standard of care. So for us, for interventional radiologies, we're used to do procedures both from the wrist or from the groin. There's a theoretical advantage of going through the wrist is number one, it's a more favorable angle to go into the inferior thyroid artery. As I said before, 90% of my cases are performed only from the inferior thyroid artery. So if it's a straighter shot, then that's a theoretical advantage. Number two, remember that, and this is an opinion, I cannot back it up scientifically. But philosophically, when I'm doing this procedure, in my mind, I want to do everything I can to prevent a bad outcome. Everything I can to prevent a stroke. Even if the incidence is extremely low, 1 to 3%, I want to do it so it stays as close as zero as possible.
Totally agree.
And when you're using the subclavian artery, which is the one that comes from your hand, you're avoiding crossing what we call the supraortic vessels, meaning the vessels that go into your brain. So if you have a vessel like that is going into your brain, and then you have a catheter that is crossing in underneath and can potentially limit the flow that goes into your brain, that is a risk factor for you to have a stroke.
Okay.
And if you're elderly folks, they have calcifications of their vessels. So you don't want necessarily to manipulate catheters in that area because you can flick these calcifications and send them to the brain. That's another reason why angiography on its own, it can potentially cause a stroke.
Okay.
So that is the philosophical approach. And number two is just because, number three, is because this procedure is an outpatient procedure. Nobody stays over in the hospital. They just come in, they get it done, they go home once they recover from the sedation and whatnot. So if you do it from the groin, you have to keep your leg straight on a stretcher for 2 to 4 hours, depending if you are using a closure device or not, or if you're just closing it with pressure. And that can be uncomfortable for a patient. Versus if you use the wrist, you just use a tiny little bracelet that has a balloon in there, and then you can walk around, you can go to the restroom if you want to.